Mallika Marshall joins us now. And doctor, it would make sense that the president would want to leave the hospital, but he is getting out pretty quickly.
He is. I mean, this is not the course that we would typically see with a COVID-19 patient, at least based on the medical sort of course that we think the president has had so far. This is what we know. We know that he has been still receiving an experimental drug intravenously called remdesivir. We know that he's being treated with a steroid called dexamethasone, which is often reserved for the sickest of patients, mostly with COVID pneumonia, which, by the way, can also cause euphoria and mania and affect judgment. We know that he's had at least 2 episodes of hypoxia, meaning a drop in blood oxygen levels. And it's not uncommon for patients to sort of chug along, doing fairly well, even appearing to improve, and then sort of fall off the cliff 7 to 10 days after the initial diagnosis. So typically, patients like this are monitored in the hospital, close to intensive care, just in case they get worse, or in case they experience any untoward side effects of the medications that he's receiving.
Vice President Pence and Democratic presidential candidate Joe Biden, doctor, keep testing negative. At what point are they in the clear?
So it might take some time. It can take a number of days after being exposed to the virus for a test to turn positive. So for example, if you were to get infected today and you got tested today, that test would most certainly come back negative. It can take 5 to 7 days or even more after exposure for a test to turn positive. So if, for example, the former vice president was exposed to the virus at the debate last Tuesday, if he continues to test negative for the next several days, chances are good that he wasn't exposed that day, but only time will tell.
All right, Dr. Mallika Marshall for us tonight. Thank you.